Let's take a look at Hailee Steinfeld and figure out if she's had any facial plastic surgeries over the years. Stay tuned for the side-by-side comparison and a breakdown of the costs of these potential procedures. In 2010, at the age of 14, what I'm seeing is that Hailee has equal horizontal thirds to her face. She has great full eyebrows, she has nasal tip bulbosity, and you can see here, even at age 14, nasolabial folds are very much normal. So when people are getting filler to try to obliterate the nasolabial folds, you have to wonder if that's even necessary. We're reviewing Hailee's pictures at this early age because we wanted to get a sense of her natural features. It's important to remember that people should stay away from plastic surgery at this young of an age because the face is still maturing and because people still haven't completely gotten into the mindset of being able to make full autonomous decisions with the understanding of the complications and the risks that are associated with plastic surgery. In 2011, at the age of 15, you can see that Hailee has a lower lip that's larger than the upper lip, and this is a very normal trait in pretty much everybody. Hailee has great jaw structure and a strong chin, and you can see it even at this early age. In 2012, at the age of 16, you can see that Hailee has nice youthful cheek volume, and the lower lid to cheek transition is very smooth. And this is just to highlight some of the changes that occur over time as we age. We start to lose some of that sort of baby fat, and we lose those nice smooth transitions from one zone into another on our face. You can see that Hailee's left eyebrow sits higher than the right, and as we know from all of our prior videos, asymmetry is very much normal. And you can also see that later on in life, it becomes a bit more accentuated, and we'll cover that as we go. In 2013, at the age of 17, I see no changes. In 2014, at the age of 18, there's this natural central gap between Hailee's upper and lower lips. And this is just something that's normal, intrinsic to her anatomy, and you can see a little bit of the upper teeth through that gap. In 2015, at the age of 19, there are no further changes. To the analysis board. So it looks like the cheek volume has increased. Wait a second. Wrong Steinfeld. You can see here that the bridge has been narrowed. The tip of the nose is more refined. There's also more nostril show. And that's because the tip has been rotated this way. And when doing a rhinoplasty with an open approach, the incision is hidden right here at the base of the nose, right in here. It becomes very difficult to detect that incision after some time has passed. And as far as lip filler goes, to me it looks like the lips have been enhanced here, and you can even see some of the filler settling out in the upper area here by the vermilion border as it gets into the cutaneous lip, and the overall ratio of the upper lip to the lower lip is now closer to a 1-to-1 ratio. We actually custom made our own silicone-based scar gel. We worked with a highly experienced chemist, and we incorporated information from the world's literature on wound healing to arrive at our formulation. And this scar gel was specifically designed for the face, but of course works great on other parts of the body as well. This scar gel is not white labeled. This is custom formulated with a lot of thought and research put into it. If you're interested in getting our scar gel, go to feelconfident.com. In 2017, at the age of 21, I'm seeing some signs of a brow lift. You can see that there's more distance here between the eyebrow and the upper lid margin. Also, when you look at the right side, it's now a better match to the left side, even though she naturally has a higher left brow. But now they're more in line. And sometimes you can get this with a Botox effect, but usually not exactly to this degree. So I think this was more of a surgical type of outcome. And you can see that there's more supratarsal show, and that's this area here compared to prior. And as far as the endoscopic approach to brow lift surgery, the incisions are usually made behind the hairline. And so there are typically 5 incisions. So 1, 2, 3, 4, and then 5. And through those access points, you can get down to wherever you need to be by the brows and elevate them. Let's go over the goals of a brow lift. Most people who get a brow lift feel like there's just this heaviness over their eyes, and they feel like they look more tired and they're not able to get that sort of more open eye look. And so to do that, brow lift is a nice option. And in a younger person, you oftentimes don't need to remove any upper eyelid skin, which is called a blepharoplasty. So in Hailee's case, I'm guessing that perhaps only a brow lift was performed and not a blepharoplasty. In an older person, you can do a brow lift to set the position of the brows and then see if you need to still remove any excess skin from the upper eyelids. And usually the amount of skin that needs to be removed then is less than if you were to do the blepharoplasty alone. In 2018, at the age of 22, I'm seeing some signs here of a smile makeover. It looks like Hailee may have gotten some veneers. Previously, I saw a gap between her central incisors, and now there's no more gap present. Subscribe and turn on notifications to be one of the first to see our new videos. I always do my best to engage with early comments. In 2019, at the age of 23, I'm not seeing any further change, and this is the same through 2021. In 2022, at the age of 26, I'm seeing that Hailee looks to have gotten some cheek filler. Now, as far as the cheek filler goes, you can see there's increased overall volume in the medial cheek as well as throughout the lateral cheek. Lateral cheek and medial cheek, to me, look more enhanced than they were in the past. Just to point out here, after the age of about 25, our bone density starts to decline, and a lot of the volume that is naturally in our face starts to gradually decline as well. And when people notice that, then they look for ways of trying to improve that volume and or looking for ways to lift the tissues. Now, even though facelifting is becoming more popular for people in their late 20s or early 30s, I'm not a huge proponent of doing a more aggressive type of surgery such as a facelift at such a young age because of the various risks that exist with larger procedures. And in 2023, I see no additional changes. Now, this comparison allows us to see some of the changes that have occurred over time. You can see the changes to the nose, such as the rhinoplasty that we had discussed, with the bridge getting more narrow and the tip getting more refined. You can also see signs of the brow lift that we discussed prior, with the space increasing here and having more of the supratarsal show compared to how it was in the past, the space here. You can also see the changes to the teeth. In the past, there was more of this gap, and now that gap has been closed. The lips look different, right? The upper lip has a lot more volume to it compared to how it used to be. And the cheeks appear more full. This entire area here has more fullness compared to how it was when she was much younger. And the total cost of all these potential procedures is $115,000. And here's a side-by-side comparison. Since you like this video on Hailee Steinfeld, click on our video of Anne Hathaway to see which potential plastic surgeries she may have gotten.